And now, from the CFTK-TV studios, this is Open Connection with your host, Robert Pictou.
Welcome to Open Connection. I'm your host, Robert Pictou. In addition of owning and operating over 37 schools, the Sisters of St. Anne also opened 10 hospitals. In 1969, the Sisters withdrew from ownership and administration of the Sacred Heart Hospital, also known as the Bulkley Valley District Hospital. On October 19th of this year, Northern Health medical health officers declared a COVID-19 outbreak on the inpatient unit at the Smithers Hospital following lab-confirmed case among patients. On today's Open Connection, Dr. Darren Jakubec shares how nurses champion quality care.
I am one of the staff physicians here at Bulkley Valley District Hospital in Smithers. And I do some anesthetics, some emergency room work, and a bit of clinic stuff on the side. They're busy. It's I'd say a controlled busyness. The entire last month has been busy. We were declared an outbreak. I think we had up to 11 people COVID positive, and that whatever the definition of outbreak is, but it's regardless of that definition, it's just been busy. I think we're normally categorized as 16 bed. We went up to 20 beds for COVID care and redeploying nurses, redeploying operating room nurses, canceling operations, and reshuffling staff, particularly nursing staff, but specialists and doctors with respect to the operating room. And then the doctors have put a rota just on for those to take care of COVID patients. And it's tiring. The nursing staff I'm most concerned about, and the auxiliary staff, the lab, the x-ray, the CT scans. But the nurses being redeployed in long hours, it's quite exhausting for them. And there's a number of nurses who didn't have time off or who didn't take vacations because of this pandemic, but waiting for when do you wait to take. And there's been some nurses go to casual positions or resign or move on. So I just talked to our nursing administrator, says just try to get a part-time or replacement nurse now. They don't exist. So it's particularly hard on the nursing staff. Right this moment, there's 5, and we suspect a 6th, but the test is pending, and it ebbs and flows as people get better or people pass away or people are transferred out. And the majority of people don't pass away, but we've had deaths and ventilators and people transferred out. So today's number is 5, and I think it was 2 days ago it was 11. So it does change day to day on who needs oxygen, how much oxygen they need, and how high those oxygen flows are and how long they need to be here. Wow, that's a hard question. I'm going to say 2 a day, but that could be completely off base. You can go days without a transfer and days where there's 3 or 4 transfer, but 1 to 2 a day isn't an unreasonable guess. And as for privacy reasons, they don't want us to tell exact numbers, so I couldn't get exact numbers. But way more often than you might think. We did have an intensive care unit here back in 2001, 2002, 4 beds, and they shut it down in favor of transferring the sick people out. And I feel bad for those places down south and our transportation networks and the people who have to find their way back after transfer. So we aren't as overwhelmed from an intensive care unit capacity because we don't have one. But it's quite frustrating when people get sick. We're really reliant on those transportation networks, and Terrace is very small. They're getting a new hospital. I hope they have 12 ICU beds. I hope we can take care of our own because transportation is huge. concerned that people are not coming to hospital. So sometimes the emergency room isn't as busy with non-COVID people, and you wonder, are people staying home and there's operations that aren't happening? It's tiring because it seems preventable, and there's some anger amongst the staff. Once you see how sick people get, it's like, why don't people understand what a nasty disease COVID can be? And if people would understand that, it's particularly tiring for those taking care of people with COVID, especially the unvaccinated, to say, wow, how did this person not know this is preventable? And so but you do what you can, and we're all in this together. We try and do the right thing, but
Open Connection will be right back after these messages. And now, from the CFTK-TV studios, this is Open Connection with your host, Robert Pictou.
In December 2019, the Chinese authorities notified the world that a virus was spreading through their communities. In the following months, it spread to other countries, with cases doubling within days. This virus is the severe acute respiratory syndrome-related coronavirus 2 that causes the disease called COVID-19 and that everyone simply calls coronavirus. A virus is really just a hull around genetic material and a few proteins, arguably not even a living thing. It can only make more of itself by entering a living cell. Corona may spread via surfaces, but it's still uncertain how long it can survive on them. Its main way of spreading seems to be droplet infection, when people cough, or if you touch someone who's ill and then your face, say rubbing your eyes or nose.
Thank you for staying with us. COVID-19 has disrupted everyday life worldwide and is the first disease event since the 1918 H1N1 Spanish influenza pandemic to demand an urgent global healthcare response. There's been much debate on whether the damage of COVID-19 is due primarily to the pathogen itself or our response to it. Let us return to the conversation as Dr. Jakubec shares his thoughts.
Certainly we know operations delayed. I've heard cancer operations delayed down south. We don't do many cancer operations here, but you're concerned, and we hear more side stories. We don't know what we don't know. But when the word goes out that there's a lot of COVID in the hospital, suddenly the emergency department is sometimes quieter. I mean, certainly babies are delivered and car accidents happen and traumatic things happen, and we still get busy surges. But in times like this, where the word has got out that we're at an outbreak, I think people are a little more apprehensive to come in at all, no matter what the problem. That expansion from 16 to 20 beds open, I think that was correlated directly to the outbreak. I'm not an administrator, and the redeployment of nurses is become more finalized in the holding office. We've taken operating room nurses from one place or different nurses from another place and tried to reschedule things. So just nursing hours and canceled operations otherwise, and then taking care of more people with COVID, which we take care of sick people all the time. It's not that surprising or not that different. It's just a shift in priorities for us. And there has been certainly a frustration and a worry that transportation systems won't be enough when we need them, because we're reliant. Once again, we don't have intensive care units, so we're very much reliant on our ambulance systems, and we worry that we're overwhelming those. Absolutely, but we were already worried. So in a way, it's I suppose there's a threshold by which you say you cannot take on any more work, and it makes it real that once the surgeries are canceled and once the nurses are redeployed, okay, COVID is our priority. It's not just a background irritant and something that's happening. It's actually taken over our hospital and reassigned things, which it's done down south in the bigger hospitals way more than it has here. So it's a little different that it's hit us at a small hospital. We'll certainly reduce the operating room services and I do have a different clinic on the side for some mental health stuff, and the services are strapped or reduced for that. And we know there's mental health is an issue. There's still an opioid crisis out there. And if we're not putting resources to mental health and the opioid crisis and operations and cancer, and the regular stuff still goes on, and we only have so many nurses, and I'm specifically mentioning the nurses because we only have so many, and we've taken away vacation time. You can only do that for so long before somebody says, that's it, I'm out. So we're seeing the effects of that. We're just barely talking to the nursing administration. We're just barely hanging in there, since it's more a slow accumulation of stress and exhaustion. And this is, just put an exclamation point on it.
Open Connection will be right back after these messages. And now, from the CFTK-TV studios, this is Open Connection with your host, Robert Pictou.
Coronavirus. Like many viruses, it uses a protein on its surface to attach to and enter our cells. Antibodies that fit onto this protein can block the virus from attaching. Coronavirus mRNA vaccines teach our immune system to make these antibodies. How do mRNA vaccines do that? mRNA is a genetic material that instructs our cells to produce proteins. The mRNA in the vaccine is wrapped in a layer of fat particles that protect it and help it get taken up by specialized cells of the immune system called dendritic cells. Once inside these cells, the mRNA does not enter the cell's nucleus or interact with DNA, but remains in the cytoplasm with other mRNA molecules, waiting to create the enzymes our body needs.
Welcome back to Open Connection. At the heart of the unparalleled crisis of COVID-19, healthcare workers face several challenges treating patients with COVID-19, reducing the spread of infection, developing suitable short-term strategies, and formulating long-term plans. Let us return to the conversation as Dr. Jakubec shares how the community of Smithers support the hospital staff.
You know, I'd say there's the overall stress of all the aspects of care and what might be missing, and how do we see people not in person, and how big is this outbreak, and COVID fools us. It seems like it's going away and it's back. But we in Smithers, we have a stable staff, we have a great staff, we have a fabulous community who's reached out. And one of the nurses says, if you talk to this interview, tell them about the random act of kindness that the community's done. So I think the medical staff is doing pretty well. If anything, sometimes I feel we could be doing more. I wish we still had that intensive care unit. We could do our part so the South wasn't quite so overwhelmed. It's more the overall stress, and the stress on the nurses and the lab and X-ray and CT and the infrastructure from medical records on, like the whole program. So we feel the overall stress and the slowing of things, and how do we get care for our patients. Individually, I think we're quite good as a whole. We're worried about our entire system and the care of our patients. Even in the vaccination program is an example of something that's helping keep our system afloat. It's quite easy when it's only 1 in 100 or less sometimes of people with COVID that end up in the hospital. Somebody can say, well, that vaccine's not going to help me, and they may be right. But as a system, if it's only 1% of the people, if they all get sick, it overwhelms our system. Like, we can't cope. Our ambulance, our air ambulance. So part of the reason to get vaccinated is to keep the system running. It's for our community, it's for our province, it's for the country. It's how do we keep the whole thing going? how, if a baby is stuck, how do we have the resources? We have the nurses, the doctors, the infant team. If a baby is sick or a car accident, do we have that network? And if it's all filled with people with COVID, even if it's just a small percentage, it really is the system that we see the inside of as the doctors, that we got to keep this going, because if you need an urgent operation, we got to make sure that's there. And we constantly feel that that's just on the edge of sustainable. So it's hard to see that you don't want to tell everybody to go get vaccinated on an individual level, but on a systemic level, boy, would it help. And I realize people have choices and they don't see what we see, but when you see what a horrible disease COVID can be and how disabling it can be, you can see from the inside of the system how it can cripple a system. And just talking, there's some people are on oxygen for 3 months. It's often not the case. Sometimes it's 2 days, sometimes it's 2 weeks. But if you're sitting in a hospital for 3 months, that's a lot of resources. That's just one person. It's not that common, but you can see how that adds up. But that's our constant worry. And hence the transferring out and the doing things like declaring an outbreak, so we never quite get to that point. Mm-hmm. We're able to keep our head above water for now, and there's mostly nursing staffing is our really biggest concern, I'd say. And if there's more, well, we rely on our transport systems to send people out, and we just hope that everywhere else has enough infrastructure to keep things going. But we're staying afloat.
Open Connection will be right back after these messages. And now, from the CFTK-TV studios, this is Open Connection with your host, Robert Pictou.
Needs. When ribosomes read the vaccine mRNA, pieces of the viral surface protein are made. These pieces are then displayed on the surface of the dendritic cell. The dendritic cell travels to a nearby lymph node, where it presents the surface proteins to other cells of the immune system. Some of these cells, called helper T cells, train B cells how to make antibodies that will fit perfectly onto the surface protein of the virus. Other cells stimulated by the protein pieces, called cytotoxic T cells, can kill virus-infected cells. Now, when the coronavirus tries to infect us, our immune system is ready, immediately recognizing, neutralizing, and destroying it before we ever even have a chance to become sick.
Burnout is an occupational hazard in healthcare, which harms the healthcare system, patients, and healthcare workers. In the COVID-19 pandemic, burnout has increased to levels that pose a threat to maintaining a functional healthcare workforce. In this final segment of Open Connection, Dr. Jakubec shares how the COVID-19 pandemic has created a cycle of understaffing alongside difficult work conditions, which can drive burnout.
As mentioned, a number of nurses they're just burnt. They're exhausted. This pandemic is ongoing, and they've been doing overtime shifts for many months, just hanging in there until the pandemic's over. But at some point, you got to take a vacation, or you got to take time off, or you're going to be on stress leave. So we're slowly burning out nurses and begging them to come back and do shifts here and there. So there is, in terms of numbers, there's enough nurses. But in terms of can we keep them working and safe and sane and stable in a long-term way, that's our concern. I try to let the public health people do that if at all possible. They're trained, and I don't want the public, I don't want people to think you're going to get lesser or better care if you come into the hospital one way or the other. I'd rather build bridges than walls and hope that people will follow the advice of the public health specialists, because I agree with that advice. And I don't want people to feel unwelcome, no matter if we disagreed with everyone's decisions. We'd be disagreeing with a lot of people that come into our emergency rooms and use our system. And it's not our job to disagree with people. We can give the best advice we can. And I'd follow the public health officer's advice. And in the meantime, do what we can around that. And I can tell you, vaccines are very effective at keeping young, healthy people out of hospitals, and they are good at keeping our system afloat. Gratitude for the random acts of kindness and the support of our system, and please, patience with us in the system who are really trying to do the best for the communities. So please be patient if things go a bit slow or a bit disorganized or not as streamlined, but we're still here, we're still available, and hang in there. This will be over at some point. A lot of smiles on the nurses' faces and the staff's faces are people bringing in food or giving gift cards for food, or articles of comfort being brought in randomly, and letters of support from the community sitting in the emergency room and in the mail room where I am right now. It really helps with morale, and I've heard a number of nurses in particular say it's very sweet. And gratitude for this engagement with what's happening in the system, because if you saw what a nasty disease COVID could be, you can see how it influences and how it can lead to exhaustion. And yeah, trust us, it can be a very nasty disease. And the other thing, just going into the future, I hope we in the North, we that live here, can take care of our own a bit better. And I really hope with the new Terrace Hospital, there's at least 12 intensive care unit beds. There's my plug, whether it'll happen or not. But I really wish we didn't have to transfer so many people out. And thank you, everybody, for kindness and support during all of this.
To nurses on the front line, your passion, courage, and perseverance to develop innovative solutions in the midst of the COVID-19 crisis has inspired us all. When PPE was scarce, a nurse leader sprang into action and used layers of surgical draping and air conditioner filters to create a mask designed with high filtration efficiency. A team of nurses piloted and proved that putting IV pumps outside patients' rooms could help preserve PPE. A nurse repurposed items like a bike helmet harness and a tablet screen protector to create a powered air purifying respirator. Knowing that proning patients could help improve oxygenation, a nurse created an interdisciplinary proning team that trained over 80 staff members in 3 days. And when families were prevented from visiting loved ones in the hospital, a team of nurses implemented a tool to help connect family members to nurses and doctors.
Thank you for joining us for this episode of Open Connection. The greatest distance in the existence of man is not from here to there, but the connection from his mind to his heart. If we can conquer that distance, we can soar like an eagle and realize our immensity within. I'm Robert Pictou.